So now I'm going to talk a little bit about frozen embryo transfers. So I do see a lot more women these days being offered frozen embryo transfers, and I think they are a good thing. So they are quite often offered, more often offered to women who are basically might have polycystic ovaries or have so either the syndrome or ovaries which are behaving in a polycystic fashion, which I have spoken about earlier. So what happens with these women is that when you are giving the ovarian stimulating drugs, when you're in the stimming phase, you can actually massively over respond and produce loads of eggs and follicles, which sounds great in theory, but actually you can produce too many, and you are more at risk of hyperstimulation. So in these women, sometimes if they are stimulated too much, then they actually have to abandon the cycle. So they have to just stop the whole treatment and wait for the ovaries to recover and to go back to a normal size. So what they tend to do these days, and if they know that somebody has got that tendency, if they've definitely got the syndrome or ovaries that are behaving in a polycystic way, then they are much more likely to go for a lower stimulation, a slower stimulation, and then offer you a frozen embryo transfer. So that gives you a chance to have a break basically in between treatment, and it also means that you have slightly more control over the cycle. So quite often the embryo transfer can be 3 months after you've taken the first set of drugs. So I think some people can find that a little bit frustrating. So I think once you've decided that you want to get on with IVF, some people just want to crack on with it and just really get on with it. But actually, I think that whole period of doing a fresh transfer can sometimes, for some people, be a little bit stressful, because you never really know when the embryo is going to be ready to put back in. So it can be a 3-day transfer, it can be a 5-day transfer, and it's kind of being on tenterhooks for that whole period. Whereas if you're doing the frozen transfer, you know, you've got the embryos, you've got them to blastocyst stage, and then they're frozen, and then when they come to put them back in again, you have a lot more choice around when it's happening. So it doesn't have to be slap bang in the middle of the Christmas holidays, for example, or when your cousin Mabel's planning to get married. So it can be less stressful in that way, and you can work your work schedule around it as well, so that you can have a bit of time off, gentle time, avoiding stress around the time of transfer. So I am all in favour of frozen transfers, especially if you are somebody who's got a tendency to overstimulate or hyperstimulate, because you know, you don't want to be going straight into a fresh cycle with that, and it can be actually uncomfortable and dangerous as well. Okay.